There is a moment that happens in almost every doctor's office over and over again all across this country. A patient sits down, something has gone wrong, a number is too high, a scan shows something it should not, a test comes back with bad news. And the doctor, sitting there with the chart in front of them, has the same quiet thought they have had 1,000 times before. This might have been prevented. Not with a miracle, not with some expensive treatment, with something simple, something the patient could have done years earlier if only someone had explained it clearly enough, early enough, in a way that actually stuck. That is what this video is about. We are going to go through the health rules that doctors genuinely wish more people over 60 understood and actually followed. Not complicated protocols, not expensive interventions, but simple, almost embarrassingly basic practices that have an outsized effect on how long you live and how well you live during those years. And I want to be upfront about something. A few of these are going to sound too simple to matter. That is exactly the trap. The things that sound too basic to bother with are very often the things doctors say make the biggest difference of all. Stick with me through this whole video because we are going to end with the one rule that doctors consistently point to as having the single biggest long-term impact, and it is not the one most people guess. Welcome to Longevity Insight, the channel built around real, evidence-based information for healthy aging. If you have not subscribed yet, now's a great time. We publish new videos every week covering exactly this kind of practical, research-backed health information, and there is a growing community here of people who are taking their health seriously without falling for trends or gimmicks. Hit subscribe and let's get into it. The first rule doctors wish more people understood is simple to state and shockingly underfollowed. Know your blood pressure numbers and check them regularly. Here is why doctors care about this so much. In 2024, high blood pressure was a primary or contributing cause of 680,179 deaths in the United States. Nearly half of all U.S. adults have hypertension, and it is a preventable, treatable risk factor for heart disease and stroke. But here is the part that should genuinely concern you. High blood pressure typically has no symptoms at all. You can feel completely fine, energetic, clear-headed, normal in every way, while your blood pressure is quietly damaging your arteries, your heart, your kidneys, and your brain. It can quietly harm your heart, kidneys, and blood vessels long before you feel any symptoms. A 2025 survey in the United Kingdom found that nearly half of people mistakenly believe high blood pressure comes with obvious symptoms, when in fact it is often completely silent until it causes serious harm. And only about 1 in 10 people knew they should be checking it regularly after age 40. The pattern in America is similar. People assume that if something were wrong, they would feel it. With blood pressure, that assumption is dangerously wrong. The 2025 update to National Blood Pressure Guidelines also strengthened the link between hypertension and brain health. Keeping blood pressure in a healthy range may help lower the risk of cognitive decline and dementia later in life, because high blood pressure damages the brain's small blood vessels over time. This means blood pressure is not just a heart issue, it is a brain issue too. The practical fix here could not be simpler. A home blood pressure monitor costs less than a dinner out and takes about a minute to use. The correct technique matters. Avoid caffeine, exercise, or smoking for at least 30 minutes before measuring. Sit in a quiet room with your back supported and feet flat on the floor. Rest for 5 minutes and take 2 readings 1 minute apart, recording the average. Checking your numbers weekly or even just monthly and tracking the trend over time gives you and your doctor real information instead of a guess made once a year in an office visit. This is one of the cheapest, simplest, and most consequential habits a person over 60 can build. The second rule is one that doctors mention constantly, but that gets dismissed because it sounds too obvious to be important. Move your body every single day in whatever way you genuinely can. We have covered the deep research on walking in other videos on this channel, so I will not repeat all of it here. But it is worth restating the core finding because it bears directly on this list of doctor-recommended rules. A major 2025 analysis published in the Lancet Public Health found that 7,000 steps a day was associated with a 47% lower risk of death, a 38% lower risk of dementia, and a 25% lower risk of heart disease compared to people who only walked about 2,000 steps a day. What doctors specifically wish patients understood is that this does not require intensity. It does not require a gym membership or a structured program. The American Heart Association's own framework for cardiovascular health, called Life's Essential 8, lists physical activity alongside not smoking, healthy diet, healthy body weight, sleep health, and control of cholesterol, blood pressure, and blood sugar as the core pillars doctors track to assess a person's heart health. Movement sits right at the center of that list, not as an optional extra, but as one of 8 fundamental factors that determines cardiovascular outcomes. The doctor's frustration, if there is one, is usually about consistency rather than ambition. Patients often say they will start a serious exercise program and then stop after 2 weeks because it was too demanding to sustain. What actually changes long-term health outcomes is not a heroic 6-week sprint of intense exercise. It is daily, moderate, sustainable movement that continues for years. A walk after dinner, taking the stairs when reasonable, standing up and moving every hour instead of sitting for 3 or 4 hours straight. These are the behaviors that doctors see translate into better outcomes over time, because they are the behaviors people can actually keep doing. The third rule centers on something doctors increasingly emphasize as one of the most underrated indicators of overall health: grip strength, and more broadly, maintaining muscular strength as you age. This is going to surprise some people because grip strength sounds like a strange thing for a doctor to care about. But the research behind it is remarkably consistent and has been growing rapidly in recent years. Research has found that for each 5-kilogram reduction in hand grip strength, there is a 16% increase in the risk of all-cause death. And hand grip strength has been found to be a more powerful indicator of overall mortality and cardiovascular mortality than systolic blood pressure. That is a striking statement. A simple grip strength test may predict your health outcomes better than your blood pressure reading. A meta-analysis of 42 studies found that individuals with low grip strength had a 67% higher risk of early death from all causes compared to those with high grip strength. Lower grip strength is also linked to a nearly 2-fold increased risk of cognitive decline and dementia. The reason grip strength matters so much is not really about the hands themselves. Grip strength serves as a proxy for overall upper body strength and muscle mass, and a decline in grip strength is often a flag for broader issues including muscle loss, reduced neuromuscular function, and metabolic decline. When muscle strength diminishes generally, people move less, which compounds cardiovascular decline, insulin resistance, and fall risk. What doctors wish more people understood is that muscle strength is not something to address only after it has become a problem. It needs ongoing, deliberate maintenance, and the encouraging news is that even modest effort produces measurable results. Muscle strengthening activities for just 30 to 60 minutes weekly reduce the risk of all-cause mortality, cardiovascular disease, and cancer by 10 to 17%. That is 30 to 60 minutes a week, not a day. Simple resistance work, body weight exercises, light weights, resistance bands, or even consistent activities that require pushing, pulling, and carrying. This does not need to look like a young person's workout. It needs to be consistent. The fourth rule is about prevention through screening. And this is an area where doctors see enormous variation in how seriously people take it. Preventive screenings help identify potential health problems before symptoms arise And by catching conditions like heart disease, osteoporosis, or certain cancers early, you increase your chances of successful treatment and better health. An annual checkup is more than a routine appointment. It is when your doctor reviews your medical history and can detect early signs of chronic conditions like high blood pressure or diabetes. And it is the right time to discuss any health changes you have noticed, even ones that seem small.
What doctors find frustrating is not that people refuse screenings outright. It is that people often delay them, sometimes for years, because they feel fine and assume that feeling fine means nothing is wrong. But many of the most serious conditions doctors screen for, certain cancers, osteoporosis, early cardiovascular disease, diabetes, are silent in their early stages. By the time symptoms appear, the condition has often progressed to a stage where treatment is harder, more expensive, and less likely to fully succeed. Cholesterol checks, blood pressure monitoring, bone density tests, and cancer screenings, including colonoscopies and mammograms, are among the core screenings doctors recommend based on a person's age, medical history, and family background. The specific schedule varies by individual, which is exactly why an honest conversation with your doctor about what you personally need, rather than relying on general assumptions, matters. The rule here is simple. Do not wait for a symptom to schedule a screening. The entire purpose of preventive screening is to catch problems before symptoms exist. The fifth rule is one that often gets treated as a footnote in health conversations, but doctors consistently rank it as central. Get enough quality sleep and protect it like you would protect any other vital function. Sleep health is explicitly listed as one of the American Heart Association's Life's Essential 8, placed alongside not smoking, physical activity, healthy diet, healthy weight, and control of cholesterol, blood pressure, and blood sugar as a core determinant of cardiovascular health. That placement is intentional. Sleep is not a lifestyle preference. It is a biological necessity that directly affects cardiovascular risk, metabolic regulation, immune function, and cognitive health. What doctors wish Passion understood is that sleep problems in older adults are common, but not something to simply accept as inevitable. Many sleep issues that develop with age, difficulty falling asleep, frequent waking, lighter and less restorative sleep, have identifiable causes and addressable solutions. Late caffeine intake, irregular bedtimes, alcohol close to bedtime, excessive screen exposure before sleep, and untreated sleep apnea are common, modifiable contributors that doctors see repeatedly, but that patients often do not connect to their fatigue, mood, or cognitive fog during the day. The practical message here is to treat sleep with the same seriousness you would treat diet or exercise. A consistent bedtime and wake time, a cool, dark bedroom, limiting caffeine in the afternoon and evening, and discussing persistent sleep problems with a doctor rather than assuming they are simply part of getting older. These are the behaviors doctors wish more patients adopted before sleep issues compound into broader health consequences. The sixth rule involves something doctors see go unaddressed constantly, often because patients are embarrassed or unsure it is worth mentioning. Report changes in your body, even small ones, rather than waiting to see if they go away. This is less about a specific test or number and more about a pattern of behavior. Doctors consistently describe a frustrating dynamic where a patient mentions, almost as an afterthought near the end of an appointment, something that has actually been going on for months: unexplained weight loss, persistent fatigue, a new lump, changes in bowel habits, unusual shortness of breath, vision changes. The patient often assumed it was minor or was simply aging or did not want to seem like they were overreacting. But early reporting is exactly what makes preventive medicine work. The entire value of regular checkups and screenings is undermined if patients withhold information about changes they have noticed because they assume it is not worth mentioning.
Doctors are trained to evaluate symptoms in context. What seems minor to a patient is sometimes the single piece of information that changes a diagnosis. The rule here is straightforward. If something in your body has changed and persisted for more than a couple of weeks, mention it. Write it down before your appointment if you tend to forget. Bring it up first, not last. This is one of the simplest things a patient can do, and it consistently makes a difference between catching something early and catching it late. The seventh rule is about nutrition, but framed in a way that doctors find more useful than most diet advice. Focus on consistency and whole foods rather than chasing the latest trend. Doctors see a particular pattern repeatedly. Patients who jump from diet to diet, trying the latest popular approach for a few weeks before abandoning it for the next one. The research on long-term health outcomes does not support this pattern. What it supports is sustained, moderate, whole food-based eating maintained over years, not perfect adherence to any single trend. The WHO and American Heart Association agree that the majority of cardiovascular disease deaths are preventable, and the key interventions are well established. Reduce salt intake to lower blood pressure, increase physical activity, quit tobacco, eat a heart-healthy diet, and control blood pressure and cholesterol with medication when lifestyle changes are not enough. A plant-based diet can significantly reduce cardiovascular disease risk, and addressing sleep health matters too, since sleep apnea is an underdiagnosed risk factor for cardiovascular disease. What doctors wish people understood is that nutrition does not need to be complicated to be effective. More vegetables, more fiber, more lean protein, less ultra-processed food, less added sugar, moderate sodium. These basic principles, followed consistently for years, outperform almost any specific name diet followed perfectly for a few months and then abandoned. The frustration doctors feel is usually not about a patient's effort. It is about the cycle of starting and stopping that prevents any approach from accumulating the benefits that only show up with years of consistency. The eighth rule addresses something that doctors increasingly recognize as medically significant, even though it does not always feel like a medical issue: maintaining social connection and a sense of purpose. This may feel like a softer recommendation compared to blood pressure checks and screenings, but the research connecting social isolation to physical health outcomes has become substantial enough that doctors now treat it as a genuine clinical concern. Isolation and loneliness are associated with elevated inflammation, higher cardiovascular risk, faster cognitive decline, and weakened immune function. The biological pathways are: real chronic loneliness activates stress responses in the body in ways that parallel other chronic stressors with measurable downstream effects on health. What doctors wish more people understood, especially men after retirement, is that the social structure that used to come automatically through work colleagues, daily interaction, a sense of contribution, needs to be deliberately rebuilt once that structure disappears. This is not abstract advice about happiness. It has concrete implications for inflammation, cardiovascular risk, and cognitive decline. The doctors who raise this with patients are not simply being kind, they are addressing a measurable risk factor. Now the final rule, the one I mentioned at the beginning, the one that doctors consistently describe as having the single biggest impact over the years, and it is not a specific test, a specific food, or a specific exercise. It is something simpler and in some ways harder than all of those things. That rule is this: act on the early information you already have, instead of waiting for a crisis to force your hand. Here is what doctors mean by this. Most people over 60 are not actually lacking information. They generally know that their blood pressure should be checked. They generally know that movement matters. They generally know that sleep is important and that screenings catch problems early. The gap is rarely about knowledge. The gap is about timing. about acting on a borderline blood pressure reading before it becomes a diagnosis, about addressing a persistent symptom before it becomes an emergency, about starting consistent movement before strength has declined to the point where rebuilding it becomes genuinely difficult, about getting a screening on schedule instead of pushing it back another year because life got busy.
According to the most current statistics, the majority of cardiovascular disease deaths are preventable, and the word preventable is doing a lot of work in that sentence. Prevention only functions if it happens before the problem, not after. Doctors describe a consistent pattern across decades of practice. Patients who took early, sometimes small action on the information available to them tend to have meaningfully better long-term outcomes than patients with the same starting risk factors who waited. Not because the waiting patients did not know what to do, because they postponed doing it. This is the rule that doctors say matters most, because it is the rule that determines whether all the other rules actually get followed. Knowing your blood pressure numbers does nothing if you do not act on a high reading. Knowing that movement matters does nothing if you keep waiting for a better time to start. Scheduling a screening does nothing if you push it back year after year. The single biggest predictor of long-term health that doctors observe is not intelligence, income, or even access to care in many cases. It is the willingness to act now on what you already know rather than waiting for circumstances to force the issue. Let's bring this all together, because the pattern across every rule is the same. Know your blood pressure numbers and check them regularly, because the condition is silent until it is not. Move your body every day in a sustainable way, because consistency outperforms intensity for long-term outcomes. Maintain your muscular strength, because grip strength and overall muscle mass predict mortality more powerfully than many people realize. Keep up with preventive screenings on schedule rather than waiting for symptoms. Protect your sleep as seriously as you would protect your diet or your exercise routine. Report changes in your body promptly instead of waiting to see if they resolve on their own. Build your nutrition around consistency and whole foods rather than chasing trends. Maintain social connection and purpose, because isolation carries measurable physiological costs. And above everything else, act on the information you already have today, rather than postponing until circumstances force the decision. None of these rules require expensive products, complicated routines, or dramatic life changes. That is precisely the point doctors keep trying to make, often without enough time in a 15-minute appointment to fully explain it. The biggest gains in long-term health rarely come from sophisticated interventions. They come from simple, consistent, timely action on the basics sustained over years, not weeks. This is exactly the kind of practical information Longevity Insight exists to deliver, translating what doctors and researchers know into something you can actually use this week. If this video gave you a reason to check your blood pressure today, schedule that overdue screening, or simply take something on this list more seriously, I want to know about it. Leave a comment below and tell me which of these rules you are already following well and which one you are going to start paying more attention to. I read every comment on this channel, and it genuinely shapes what we cover next. If you found this valuable, please share it with someone who could use a reminder: a parent, a sibling, a friend who has been putting off a checkup, or ignoring a symptom they should mention. This information might be exactly what nudges them to take the next step. And if you have not yet subscribed to Longevity Insight, now is the time. We publish new, research-backed content every week to help you make informed decisions about your health as you age, not with fear, but with clarity. Because the goal is not just living longer, it is living well for as long as possible.